It's been exactly 7 months since the World Health Organization was informed of the COVID-19 outbreak in China. Now, in Africa, confirmed infections from the 55 countries have passed the 400,000 mark. Fatalities are also on the rise, with more than 10,000 people who have succumbed to the illness. We're joined by Mary Stephen, who is the World Health Organization's Technical Director for Africa. Good evening, Mary, and thank you so much for your time. Comparatively, when you look at how the disease is spreading on the African continent, what would you say are some of the similarities and perhaps differences to what you've seen in the rest of the world?
Yeah, thank you. Yes, the outbreak continues to evolve on the continent, and we are seeing increasing number of cases in Africa. We haven't seen the peak of the outbreak yet. Yeah, so some of the differences is that Africa managed to slow down the progression of the outbreak, basically by ramping up all the public health and the social measures right at the beginning of the outbreak. So this has helped Africa to buy more time to ramp up all the capacity to detect, to test, to isolate, contact trace, and treat the patients. So some of the differences we are, the similarities that we are seeing is the fact that as countries begin to lift or ease the lockdown and the other measures, we are beginning to see, of course, additional number of cases being reported. And this is what we see globally as well. As the economies are reopening, additional number of cases are being reported.
Of course, the big question is going to be around the kind of capacity that states are left with when they do experience a higher influx of COVID-19 positive cases. To that effect, are you convinced about the fact that countries have been fully and well equipped to respond to their peaks, especially given some of the problems logistically with moving equipment around globally due to the shutdowns that have been effected in different parts of the world?
Yeah, so preparedness is a continuous process. We need to continue to enhance these capacities as the cases evolve. Yes, the issue of closing of the borders has affected the movement of both equipment and even experts that could deploy to support countries. But quite a number of countries in Africa also allow movement of cargo, and they currently, the humanitarian corridor is open in most parts of the countries where experts can go there and support. So for the capacities, we have to continue to enhance whatever we have to be able to detect early, to test, to isolate, to treat, and contact trace these cases, and also decentralizing these capacities to all the levels of the health systems, including the district level and the communities.
Now, you talk about the humanitarian channel being open, but of course, one of the issues that has been raised, especially by civil society movements, is exactly that in this moment, there are some parts of the continent where urgent help has not been able to reach because of the slowdown of movement. But also, there's a serious question around what is happening in different countries and the extent to which international bodies, such as yourself, can speak credibly on those issues, because there's a suggestion that access is not the way that it would have been before.
Yes, so not all countries are open yet, but the World Food Program helps with movement of both equipment and some of the essential supplies, the PPEs, to the countries. And movement of, we've been able to move quite a number of experts to some of those countries that require additional support. So yes, we need all countries in Africa to grant that humanitarian access, both equipment and human resources can go over there to support the response.
Right now, when we look at the continent, South Africa's rate of infection, of course, is rising quite rapidly, and the numbers are higher than anything else we're seeing in the continent. How concerned are you about that?
Sorry, can you get me the question again? I lost connection.
I was asking about South Africa's high rate of infection and the fact that currently we, of course, are leading the trajectory when it comes to the number of COVID-19 cases. How concerned are you about that?
So for South Africa, yes, South Africa is reporting the highest number of cases on the continent, but we have also seen really the concerted effort by government to limit the spread of this outbreak. So increasing number of cases in most countries is concerning, but it doesn't mean that control is not possible. It is still possible to control the outbreak. What we need is to make sure that these measures we are implementing is sustained, and where we need to expand, we expand the capacity to detect, to test, to isolate, to treat, and contact trace, including the preventive measures by the community. So observing the at least 1 meter distance, hand washing, respiratory etiquette, wearing of face masks when we are in public places, and avoiding public places where necessary. So the government effort is there, but also the community have a personal responsibility to play in ensuring that they adhere to these measures. With this, it will take some time if you have widespread outbreak, but definitely control is possible. We can see from the most complex outbreak that took place in DRC, almost over 2 years, the outbreak has come to an end where we have insecurity. So there is hope. We can still control the outbreak. The most important thing is to sustain the measures, not to be complacent, and for the general public to make sure that they observe the preventive measures as well.